There is nothing worse than seeing one of your loved ones suffer, and Carol Stern knows that pain all too well. She shares her journey in a new book, and she joins us now alongside co-author David Black. Thank you so much for being with us.
Thank you for having us.
Carol, I want to start with you. The book is called Ripped Apart: Living Misdiagnosed, and it tells a story of one of the largest individual medical malpractice awards in America. Tell us why you and David wrote this.
I want I wanted to help other people so they don't have to go through the pain and suffering that my husband endured simply because people didn't ask the right questions.
One of the remarkable things about the book and Carol and Gary's story is Gary spent almost 4 years of his life with his internal organs on the outside of his body because the doctors didn't listen to the patient. And Carol intervened and was with him for almost every night that he was in the hospital. She was in the hospital, making sure he got good care. And most people don't have an advocate like that. And one of the reasons the book was written was to let people know how to be an advocate for those you love.
Give us a little bit of backstory about what your husband, Gary, was dealing with, Carol, how you were his support during this time, and also what makes your story so relevant right now, specifically.
Well, my husband has had Crohn's since he was 13 years old. And in the year 2000, they started him on a 6-month Remicade, which was a miracle drug, according to my husband. And they removed a little bit of his small intestine. And he was fine. And in 2011, when it all started, he was still fine until he started having pain in his upper abdomen. And at first they thought he was having a heart attack. And then the doctors came in and were saying it was his Crohn's disease acting up. And my husband was saying, no, it's not my Crohn's. That's not my problem. That's not where it's at. And the doctors didn't listen to him. Doctors did tests. They came back inconclusive. So they gave him medication for Crohn's, put him in the hospital, which made his condition worse because the medication they put him on was prednisone and Toradol. And my husband had an ulcer and it perforated, but they didn't find out until after they went into exploratory surgery on him. And it started a lot of bad complications.
And it sort of snowballed from there. And you say that this book is no polite narrative and that it pulls back the curtain about the American healthcare system. I guess for you, David, explain what that means when you got involved in this project to really pull back that curtain.
People want to know what's really wrong with the American healthcare system. Read this book and listen to Carol's story and be willing to challenge doctors. Most people defer to doctors, and doctors like that because they're the experts, right? They've got all that debt built up and that they have to justify their position. And so they're the doctors and we're ignorant, even though we know our bodies better than they will ever know it.
As sad as this story is, it really is a beautiful love story. Your commitment to your husband and being there with him through these dark times and knowing that he could count on you is really, really miraculous and a gift to him.
Well, I was the lucky one. My husband loved me more than life itself, and I was blessed to get my true love, and I would do anything. Through that process, you have people that would come up and say, I don't know how you do it. I would have left. I stood before God and promised it better or worse. That doesn't mean you leave when things get a little rough. And when you see your loved ones suffering so intensely as I saw my husband suffer, you want to do whatever you have to do to take care of them. And that's all I did.
Carol's commitment to her husband's care was so intense that she invented a procedure that's still being used by doctors and nurses. And she did not get a patent on it. It's there for anyone to use. And part of the reason for the book is to give people a map of how to get through this. Also, it's a very human story, which, despite all the problems and the horror, um, they kept their sense of humor. They occasionally got angry, it's true, and Gary at one point ran down the hallway with his IV bottle chasing a doctor who had done something wrong. But it's a wonderful human story with the background in a context that we all understand because we're all part of it.
The name of the book again is Ripped Apart: Living Misdiagnosed. Where can we get that book?
Amazon, bookstores, Barnes and Noble.
Well, Carol, our hearts go out to you, and we are just so impressed and thankful that you were able to turn this experience into a book that's going to help so many other people. Kudos to you too, David, on working on this book. And we'll be right back with more Midday Maryland right after this. Stay tuned.